Welcome to Illuminating Health, the UCSF School of Nursing's podcast that sheds light on health and healthcare issues affecting our daily lives. My name is Athen Kegler, a current student in the BSN entry to DNP pathway, and today I'm joined by UCSF School of Nurse Associate Professor Liz Castillo. Thank you for joining today's episode.
Thank you so much for having me.
Of course, it's a great pleasure to get a one-on-one with a lot of the great professors that we have at UCSF. Today, we're going to be focusing on a broad topic that really hits home for a lot of people in our rural communities: hypertension, diabetes, and heart disease, all leading causes of death in the United States. They are seen at significantly higher rates in rural communities where access to healthcare providers is often limited. Dr. Liz Castillo is a nurse who has spent her career increasing access to primary care for rural communities in California. And as an associate professor in the School of Nursing, Liz has strengthened California's rural healthcare workforce by training UCSF advanced practice nursing students within rural communities where they plan to work. Liz, you grew up in Stockton in California's San Joaquin Valley, a rural part of the state. When you think back on your childhood, how do your experiences shape your understanding of healthcare access and your decision to pursue a career in nursing?
Yeah, thank you so much for asking, Ethan. So, I was born and raised in Stockton, California, and this is where my family immigrated from Mexico. It's been, it was a beautiful childhood. I love being here so much so that I currently still reside in San Joaquin County. And that being said, when I grew up, you don't recognize the things that you don't have. And to be completely honest, uh, my grandparents were day laborers, worked in the field and worked in a lot of the canneries that are in town. My parents, when they were younger, were day laborers, but they were, starting out. They were first generation to college students, and so they did, have that vision of having a brighter future. And we absolutely benefited from that. That being said, it definitely draws me to wanting to seek out opportunities to be able to improve the community in health. Period. I have two sisters, and both are in healthcare, and I'm in healthcare. I think that it is probably a testament to what we saw as far as the lack of access, lack of ability to be able to obtain just day-to-day preventative medicine or acute chronic care management amongst our families who really have suffered from really significant and debilitating consequences of chronic disease and lack of being able to access adequate care. So our call was, interestingly in the field of health, and so being able to come back to a community, it honestly gave me so much. I really would not be who I am or where I am without, first and foremost, my family, but also the community that helped raise me. My parents were not home, and to be able to help because they were out working and doing all to help us, be provided for. And so when I say the community raised me, I mean, I'm talking about, community resources, being able to obtain help by seeking care through the Department of Public Health and getting vaccines and doing all that stuff. That is how I was raised. And I'm so grateful for the resources that we have in San Joaquin County, as limited as they were in the past and still continue to be. And I just feel a calling to be able to improve the quality of life that that my that my community is kind of requesting, wanting, and needing.
Wow, thank you for sharing. That sounds like a very just a wholesome and beautiful full circle moment, from your background to your career. And you touched on a little bit about this already, but I mentioned at the top of this episode that conditions like diabetes, hypertension, and heart disease are seen at higher rates in rural areas. So, what do you think are driving those disparities?
In my vast assessment of San Joaquin County and its need to be able to have additional resources, I have been involved in a few grants that have looked very specific to this actual question. We have a significant shortage of health professionals, quite specifically primary care and specialty services that really do create um, unnecessary and out of unnecessary um, need for individuals to actually seek out care and kind of create congestion in emergency rooms. And so the fact of the matter is that preventative care is challenging. We know this is an existing issue, but when you don't have accessibility of routine primary care to be able to treat and manage chronic disease, there are significant consequences as a result, and the sequela of diabetes that has not been managed for months, years, um, can be a struggle. There are cultural barriers, there are language barriers, there are so many barriers that we have to overcome. And I mean, that's really kind of my purpose is to try to be able to bridge those barriers and try to bridge those gaps, those disparities that we see in underserved communities, in rural communities, are one and the same. So Stockton is one of those cities. There are so many out there that really just need a lot of attention and support.
Wow. That's definitely a very complex and difficult situation to be able to, connect all these different services that we know there's a huge need to it. Do you have any opportunities to share a patient story or any significant patient interaction that stood out to you recently?
There are countless stories that I could go on and on about. My patients, this community, they mean so much to me. I think that it has been really helpful in being able to be practicing in the same community with the same federally health qualified clinic for over, you know, 18 years, a little over 18 years. And I think that that has helped to develop and create trust amongst not just the community, but with individual patients. And I think that I get really excited, probably more excited than a lot of my patients do, about their successes. And many I'm going to say like one kind of that sticks out to me is a gentleman who came to me after having myocardial infarction, so having a heart attack, was referred to the clinic as a transition of care, and also quite coincidentally had diabetes that had not gone unnoticed, but just not really addressed because wasn't routinely and regularly seeing a primary care provider. So he comes to me, and medicine is laughter for me as well, and so I try to inject that as much as possible. I really, somebody's not going to listen to me if they don't understand that I have great empathy and I can understand where they're coming from. So, that trust building is so essential and so important, because we could list off facts until we're blue in the face, but to be completely honest, we need to be human and treat everybody like humans. And so that's really what I did on a human level. Got to know what's going on, because there are so many different aspects. Like I mentioned before, there are just so many external variables, which societal, economic, and environmental variables that should not dictate one's health, right? And yet somehow they do. So getting down on a human level, understanding the existing social determinants of health, and recognizing the limitations and or availability to be able to implement treatment or management of chronic diseases. So, again, if someone's living out on a dirt road, a rural road, or rural community, and doesn't have access to street lights, and is coming home really late at night, me asking them to go outside and walk, for 15, 20 minutes might not be a very safe option. So understanding what types of interventions are going to be essential and or necessary for individuals to be able to implement safely, effectively, and sustain, to be able to sustain such interventions. So having said that, we really got down to what's going on. How's it going? Like, what can you do, right? Really a very, very patient-centered approach to um, how life is and what we can manage. And ended up connecting so much so that we were able to allow him into shared medical appointments. And in shared medical appointments, it really is just now groups of individuals sitting together, like-minded individuals sitting together with existing chronic conditions and talking about what's going on. And so we were able to do that. I got to know this individual a lot better than we had in, just a one-on-one setting, and ended up having blood pressure control in, a couple of months with really good medication management, adjusting diet, losing weight, right? All those really great things. Dropping an A1C of you probably have only heard of this in papers or in stories, but A1Cs will be counted up until 14, and oftentimes this individual would have an A1C greater than 14. And so it came in and was able to get his A1C that tells us the control of his blood sugar for the last 3 months under 7, and it was a huge success. I know that I was really happy for him, and I think that the most important thing is the success was him understanding what was happening, him seeing the growth, him seeing his improvement, him understanding what that meant, and him being able to be a pillar in the community and to provide that education to others, and him being able to speak from a this happened to me, and this is where you can go with this. So I think that, I mean, again, I have so many stories like that, but a success is truly in somebody who's had an improved quality of life, right? So being able to say that somebody's not having to go to the emergency room, not having, um, osteomyelitis and a risk of amputation, those are successes. So I mean, our level of success really is going to vary. So while we have our medical goals of what those numbers should be like, I think somebody being able to come in and speak in their truth and having power to what they've been able to accomplish, that's honestly the biggest success. And he doesn't need to see me as well as much. He's actually not even on medication anymore for his diabetes, and he oftentimes goes to Bodega Bay to go crabbing and brings me crab every now and then, which it's February, and I probably need to loop. Hope I probably will connect with him soon because it is that time of the year over at Bodega Bay, and so I'll probably be getting my crabs soon.
That's so sweet. Thank you so much for sharing that experience. And, while I was listening to you as sharing your story, I couldn't help but think that, this is the beauty of the nursing profession and what we do. And I can definitely hear the passion that you have for the work that you do. And it really underlines how critical the role is that nurses play in rural health and what we bring as a profession to these underserved areas. And so, like, my next question to you is, in what ways are nurses uniquely equipped to lead in this area?
Oh yeah, absolutely. So nurses are really truly helping to bridge the gap that exists in communities, in rural communities, in underserved communities. So much so that you know back in 2016, when the CARE Act was initiated, that allowed nurse practitioners to be able to provide medications for substance use disorder. Um, they were really one of the fastest growing professions to be able to fill that gap. You would find more oftentimes individuals who were prescribing medication for substance use disorder. You're more often times finding nurse practitioners in women's health, in in women's health and midwifery in urban, excuse me, in rural areas, um, because they truly were the individuals who were coming in to these spaces. They are the people who lead with empathy. They are the individuals who seek out the opportunity to be able to um, help reduce these existing inequities.
Yeah, and we only know how things will look going forward, with the changes in regulations and the changes in opportunities that as the nursing evolves as a profession and how we can continue to step into those critical roles that are very much needed during this time. And so a lot of your work has been focused on increasing access to primary care in the San Joaquin Valley. So I'm wondering if you could clue us in onto about your current work in this area.
Yeah, absolutely. In San Joaquin County, quite specifically, I have, I briefly mentioned, substance use. I briefly mentioned shared medical appointments. I'm uh, currently in the process of becoming certified in, um, obesity management. And so the truth of the matter is that I think that I have a love of learning. Several years ago, probably about 3 or 4 years ago, I went back to school. About 4 years ago, I went back to school and completed my doctoral degree in nursing, specifically to be able to help myself gain the knowledge that I would need to be able to have a seat at the table. Really, it is becoming incredibly evident, as you had mentioned, Athen. It is becoming increasingly evident that nurses really are making a way for themselves, right? Nobody's handing out these opportunities, and we really do have to figure out how we can have a voice for ourselves, because in having a voice for ourselves, we are able to also have a voice for a lot of our of patients that go unnoticed, that go unseen. And so I think that it is incredibly important to do work that helps to promote access. And so that's what I've done. In the last several years, I've been a part of many grants in connection with UC San Francisco and others in being able to increase access. So one such that I alluded to earlier was the shared medical appointment. So shared medical appointments is something that we've known can improve diabetes outcomes, increase quality of life, improve A1Cs. And so I participated in that project and to be able to bring shared medical appointments to San Joaquin County patients with diabetes, living with diabetes. And that that grant has come and gone, and fortunately, those shared medical appointments are still in place. I think also participating in grants and pilot projects to be able to talk about trauma informed care. Trauma informed care is is one way of looking at what is going on in an individual's life. So looking again at those external variables and seeing if someone's dealing with substance use, if someone is dealing with, um, you know, any number of issues. Sadly, taking your medication that you have to take on a regular basis, this doesn't make you feel so great, is not necessarily at the top of your list. So understanding what external variables are existing in a patient and being able to help manage that and to be able to eventually kind of get to some of the other underlying issues that are also existing medically and psychosocially. So trauma-informed care, and then medications for opioid use disorder, or just substance use in general. I participate in grants that are aimed at screening and brief intervention. So doing a lot of uh, public health preventative care in substance use, and also after the fact. So understanding what the treatment that goes into medications for opioid use disorder, and learning how to do direct to inject, learning how to screen, learning how to provide access for individuals who are experiencing substance use disorders or experiencing homelessness. Oh my gosh, I could talk on and on and on about all the things that I'm participating in, but there's just so many things. Again, I mean, right now, obesity management, I am getting signed up to do, certification so that I can understand the different medications and, some of the medications that we use off label. And obesity is a big is a big thing right now. There's a lot of changes that are happening, and you know, a, we already know that helping to reduce weight can significantly improve somebody's A1C and their quality of life. And so I think that it all goes really hand in hand. Just again, being able to not necessarily specialize, but having the most information that I can to be able to provide to our patients, that is just a win for everybody.
And it sounds like a lot of opportunities for quality improvement projects.
Yes.
Yeah.
Absolutely.
So in your capacity as a faculty member in the School of Nursing, you prepare UCSF's advanced practice nursing students within rural communities where they want to serve. So how does this training model lead to better experiences for nurses and community members alike?
Clinical placements is a challenge for all students, all nursing students, all advanced practice nursing students. The one thing that we do know is having a variety of experiences and having a variety of opportunities will only make a clinician stronger. It will help to provide a different lens in which you can see patients. If you only ever work in an urban clinic where everybody has specialized care and specialized treatment, if you only ever get an opportunity to do that, um, then and wherever forced into forced into an experience where again we're going through a pandemic when things are shut down and what happens, and access to change in access to medical coverage happens. What happens then? It really does help to broaden and strengthen um, you know one's basic skill of being a nurse. And I think that uh, what we do is, it really is such a gift to be able to say that we practice, right? That we practice care, that I get to practice nursing. That is an opportunity, that is a gift. And I definitely do not take that for granted. That being said, so many people benefit from that. And so these clinical experiences are unique, divide, create depth and breadth into like one's being able to understand again those external variables that sometimes in other clinical experiences you're not necessarily going to see. We always look for an opportunity to be able to provide those types of experiences. We've had at UCSF um, the ability to have an extended alumni that are throughout California and even beyond, be able to provide unique experiences for our students. And I know that that our students are grateful and they've all benefited tremendously because it is a lens in which, you know, we are able to provide care. It is not the assumption that everybody has everything at their fingertips. It really comes from a truly patient-centered approach of what do you have available? How can I help? And, so many of our nurses and our nurse practitioners, our advanced practice nurses in really any setting wear so many hats. It can lead to a great deal of um, weight on one's shoulders, sometimes unnecessarily. And I think that just comes because we all love what we do so much and we're so passionate about it. But I also think that it really does help everyone to realize that they are part of a community, that there is always someone there who can help, that there is always someone to lean on. There's always somebody who has more experience than you do. And being able to call upon your peers who work in different clinical settings is a gift in of itself as well.
I know that a lot of what they offer at UCSF from my experience has been absolutely amazing, and being able to take your population health course was also a great lens and introduction to the many avenues that and role that a nurse practitioner can take. And then pairing that with, you know, community-minded nursing and community-minded um, interventions where we're tailoring what we're doing, you know, specifically to those patients' needs. I'm very appreciative of all of the great minds at the School of Nursing at UCSF that have been able to give us these opportunities and exposures and ability to grow and lean into community. So, when you're thinking about rural health in California, what gives you hope right now?
I think that that's an excellent question. I actually, when I was, I did not know what you were going to ask, to be quite honest, but that is an excellent question. I really, first and foremost, want to say thank you so much for that great compliment. And I have to kind of put that back on the students, right? The caliber of students that we accept into the program are future leaders and the nurses that are going to actually help carry on the torch, help to maintain the change that is needed to be able to increase access, to be able to reduce those disparities, to be able to provide quality care, to be able to provide holistic, patient-centered approaches for all individuals. So the truth of the matter is that you know, my hope is in you. My hope and my promise to the community. I mean, this is what we work hard for. We work hard for our students because our students demand that of us. And I think that, I mean, it might sound super cliche to say that, you are the future, but you really are the future, right? So, you know, I won't even begin to say how long ago I was at UCSF, but when I was at UCSF, I know that I felt like, I definitely had some pressure to be able to do the great work that had preceded me. And I feel that again, the level of commitment that we have to being able to teach our students is understanding and teaching and continuing to learn because you are all demanding that of us, right? We read your personal statements. We know who we're accepting into the program, and we understand your commitment and your promise. And we want to be able to help you all succeed in being able to maintain this change. So my hope truly is in those people who will take over in the next, you know, in the next 10, 15, 20 years. And so yeah, I mean, I think that talking about population health, talking about rural health, these are not necessarily things that we were doing 20 years ago. We were talking about it very broadly, very loosely, and now there are very concerted efforts. Now there are grants. Now there is a need that exists, and there is a special place that that healthcare professionals are now going to. There are health professional shortage areas, and there are loans to be able to help students who really do have a strong commitment to being able to go into those spaces. So, when you ask me you know, what do I think? What's my hope for the future? My hope is that someone acting like you who really is committed to being able to help bridge these gaps, to help reduce these disparities, to help all of our patients, all people of this world to be able to be better, do better, live happier, healthier. So
Oh, thank you very much. Yeah, I'm working my hardest. I have a year and a half left in the program, and then the real work begins. Well, thank you very much, Liz, for joining us today on this episode of Illuminating Health. And thank you to our listeners. We look forward to connecting with you next time.